Hey, welcome to a COVID-19 update. Even though it's 2021, it's COVID-19 update on 3/17/21. And I want to welcome Dr. Michael Kim. Dr. Michael, hello, welcome.
Hey, thanks, Jeff. I feel like a deja vu. We're like,
It's one of those things. I'm sure this has never happened to you, but I've had it happen to me where my date has stood me up. I noticed we're missing Dr. Krista Burris. What's going on there?
oh yeah, no, she is seeing a patient. This is not our day job. We wanted to provide good value for the community, and so the COVID-19 show is something that we want to keep people updated. But we do have a medical clinic, and so she is seeing someone. She's almost done, but she's seeing someone that wanted to come in that was having some problems. So we said absolutely. So you and I have to do a little song and dance before the brains of the operation gets on.
I love it. Well, I do have a monologue that I do in L. No, I don't. While we have a second, let's take this opportunity to really kind of peel back that layer you talked about. Hey, you guys have a clinic, you do something a little different. You do medicine differently. It's a little bit like old fashioned medicine meets new fashioned medicine, and we've left that other stuff in the dust. Can you tell us a little bit about that?
Yeah, and I'll even tie it into the COVID show. So
Okay.
we have a different model that we really value being accessible and personalizing care and not treating everyone like a number. And so we have a direct primary care model, which is a membership model that's very affordable. And every month it just renews, and you get a doctor for that month. And so we don't have to worry about what insurance is saying. We don't have to worry about 40 people running through our clinic. And so we're able to, just like where Dr. Burris is seeing someone when they need to come in, we say, sure, come in, and we have the time for that. And it also has allowed us to actually test over 200 athletes for the school district. We got a call last week with the school district in panic saying, hey, our vendor that's been doing the testing, something went wrong, and these students are not going to be able to do their sport. Can you come test? So we've tested Palm Desert, La Quinta, Shadow, and just because we really want these kids to play. And so there's not I don't know another doctor's office that would be able to say, yeah, today we can go out and do that, or yeah, we can do that tomorrow, or yeah, we can go out on Saturday. And those are the things we've done because the model is really geared around really what's best for healthcare and each person. So
I love that. Hey, this I just listened to something yesterday from for some research about how much change is happening, and a couple things I thought that were really kind of interesting and had nothing to do with the show, but everything to do with the show. And the question I'm about to ask you is, they were talking about always planning for crisis, and we think this crisis is over. And they brought up this stat, and I'll ask you, since 1988, get an idea of how many crises we've had around the world since 1988.
well, I mean, there are some that we hadn't even come to the U.S. So there's the SARS original virus. And there are a lot of different diseases that we, as a developing country, don't even think about anymore. There was this, H1N1 swine flu that came through. There are really bad flu years, and so it is a not just on a global level, but on a, even just myself. I'm trucking along, and all of a sudden something happens. And it even comes into my head, you can ask Dr. Burris, oh, my shoulder's hurting. Oh, it must be cancer. I know. And so, it is, even as a doctor, nice to have, you're someone that I can say, it's cancer, Dr. Burris. He's like, no, it's not. You'll be fine. And so, but that, that being able to have that ability and being able to reach out to someone who can then say, hey, this is probably what it is, and let's just go through it methodically and systematically and figure out what's going on. And that's really what I think is important for people's health. So,
well, I think that is so true. And I'll give you a perfect example. And I'm certain when she wakes up, she's going to contact you because I've already asked her. Is my wife came home sick from work today, and that just I can probably count on one hand and hold three fingers down and tell you how many times she has not shown up for work in the 20 plus years we've been married. And, the first thought that came through my head was, oh my God, is it COVID? And wait a minute. I said, maybe it's something like we had shrimp last night for dinner. Who knows what it could be,
Right.
but I feel great. And, so you're right. That's that first thing we do. And I just wonder how much of that it just gets hammered into us on the media, that it's never a good thing. It's always a tragedy. It's always a crisis. And so thank you for that reminder that, so when she calls you, that's, that you get a little precursor of that. But the number that was interesting to me that I wanted to share with you is 466 crises have happened in the world since 1988. And that we are in a constant state of change. And with that, it just so makes this so much sense of what you're doing is you guys have pivoted from being, I'm going to call it traditional type of doctors, but in a sense, you've never really been too much of a traditional type of doctor. Like, hey, you open up a brick and mortar, you have your bank of 2,000 to 3,000 patients, and they come in. What started you on that path?
It was the getting burnt out as a provider. We do this because we really enjoy working with people, relationships, and that was kind of getting eroded by the system. And it felt like we've compartmentalized medicine to where your primary care doctor really is just preventative medicine. You go for your routine XYZ, and if anything else happens, you can't go in there because the system is not designed for that. So that's where urgent care has popped up. And so then the urgent cares are dealing with all these more everyday things that occur. And then there's really no elegant way where they hand off, from the urgent care to the primary care, where all that used to be, in one-stop shop. Back in the day, you would go to your doctor for most things. And then when things got more complicated, then that's when you sent people out. And it seems like it's just for prevention. At least that's what it feels like. And so it wasn't feeling like, we were getting to know our patients. It wasn't, this enjoyable thing. It felt, even from our end, at least for me, a rat race. It was, get them in, get them out. If I'm late or someone's late, the whole system gets thrown that day, and everyone is miserable. And there was just no way to, I know patients don't like it. We don't like it as doctors. So we decided to look for a different system or a different way of improving it. So
it seems like a system that now that I've been, I guess, accustomed to it for, I don't know, I think I've been a member for 3 or 4 months, my wife maybe 6. And one thing is I realize I'm fortunate. I don't really have to go to the doctor. I think I've been to see you guys more in the last, 6 months than I have a doctor in the last 6 years, only because I was around somebody who tested positive for COVID, and I just had to, what you guys do, you do the rapid testing, and it was like, pull up in the parking lot and away you go and move on. And that just made it so easy for me compared to the stories I'd hear from people saying, oh, I had to sneak into Walgreens, or I had to do this or whatever just to get tested. I'm like, geez, I didn't know it was that hard. All I do is call my doctor and he says, come on in. So it's just been a treat. So thank you very, very much. One thing I wanted to do is while we're waiting for Dr. Burris, let's pull up the numbers. But before I do, I want to talk about, the numbers are very good. They're very good. And around the city, before we went on air, I said, hey, I'm noticing people are moving about. Where there seems to be a little bit of excitement. It's almost like, if you celebrate Christmas, it's almost like Christmas Eve out there. We know the present's coming. And yet yesterday I saw that Ontario, Providence in Canada, is being hit with a third wave. Are we going about this, in your opinion? I realize it's your opinion. Are we going about this in the right way by really kind of opening up and getting the schools going and or is there another way you could see, if you could have a magic wand, would you do it differently?
That's a tough question. I would say the problem is, I think the path forward is a pretty good one. It's that The small number of people who don't want to social distance and do all that, and it's their right. I'm not going to force anyone to do anything, and I have my opinion, they have their opinion. But the way forward is not without social distancing. So if we follow the plan and we're not social distancing, it's going to be a disaster. We found that last time we were here before Memorial Day. But if we follow the plan and social distance, because of the vaccines and because everything's been coming down, I think there's a good chance for that to continue. My fear, though, is that, like you said, as we open up, if people start throwing social distancing out the window, then that probably is a disaster that we saw last time we were there. So I'll let Dr. Burris weigh in and see. It looks like her microphone is muted, or.
There I am.
There you go. Hey, Dr. Burris, welcome. And we know patients come first. Thank you so much for joining us. I just posed the question of with the numbers getting better, going around town, seeing things, that excitement. It's almost like that Christmas, Eve, and we just can't wait to open up the present. And then on the flip side of thinking, okay, it's over, but then in Ontario, Canada, they've just announced that the third wave is hitting and it's really shutting down their province again. And my question with Dr. Michael was, are we going about this the right way? And if you had a magic wand, in your opinion, could you do it? Would you do it differently? Or are we doing the right thing?
Part of me is very, very worried because of more attitudes that I'm seeing from people that either I've got my first shot in, and so 10 minutes later, I'm going to go have a big party. Or, these people have been vaccinated. I haven't gotten mine yet, but they're probably safe. So just that sort of loosening is a little concerning at this moment, because really we don't have our herd immunity in place yet. There's still plenty of people out there who can spread this. And we're only probably 2 or 3 months away from hitting that point where this would be gone, unless there's another surge. If there's another surge, that's going to push that timeline out probably another, 4 months. And we're going to have 4 more months of this. I understand sort of the drive to reopen. We've been able to reopen sort of, in this modified purple way where we're doing more. If people are willing to not take advantage of the fact that you can eat indoors, to like cram a bunch of people into a small space, maybe we'll make it. Honestly, I go back and forth, because I look around and sometimes I see people who are really going above and beyond what's even required to be careful in their businesses, and they get it. And then there's other people who I feel even before things were open were already sort of pushing or bending the laws, or they've mentally sort of moved on. And if there's enough of people behaving that way, we may see another surge. Also, the new variants, now that we have more data on them, are a little more concerning. They actually do seem to have higher hospitalization and mortality rates. Initially, we thought they didn't. We thought they were just more transmissible. But now it's a little more worrisome when it looks like they actually are a little more severe. Because we know our vaccines are not quite as good against them. They're a little more severe, and they're much more easily transmitted. So because of that combination, it's not quite time to have the celebration party yet. We should be planning that for, this Christmas, not for
Boy, that sounds so far away, this Christmas, but it really isn't that far, is it?
It's not. And I'm saying that means like you can actually put up the sign and said it's in the rearview mirror. It's not. It's a little too soon to say it's done.
Yeah.
Right. It's like these next 2 or 3 months are going to decide Christmas one way or the other. And if we can really assure that, then we will have a great Christmas. Otherwise, yeah.
Yeah. Well, hey, I'm going to turn this back over to you guys now, and thank you so much. If you're just joining us, yes, this is the COVID-19 update, and we were just filling in a little bit, having a little conversation between myself and Dr. Michael Kim. Dr. Krista Burris was doing what she does. Both of them do best, and that's taking care of their patients, and she was finishing up. So I'm going to dart out of here, and I bet we're going to get into the slides or the stats, which are really good and exciting and something to look forward to, but not to let our guard down. So here we go.
Awesome. Hi, Dr. Kim. So
hey,
our
Dr.
first
Burris.
slide today is our daily epidemiology slide, and that's for the whole entire county and for March 16th. So this was yesterday's data. And what you'll see here is that our new cases are continuing to drop. We only had 110 new cases reported out yesterday, and new deaths at 27. Again, the death rates are going to drop a little slower than the case rates. We're still seeing what I consider to be an unfortunately high number of deaths at that 27 in one day. But if you go down to the next couple areas down, we'll see this really dramatic decrease that we've had here. Let's look at this one. So you'll see here that our positivity rate really has dropped. We're down at 3.1. This is great news. And that trend is still dropping. It's not, we haven't plateaued yet at that positivity rate. And this continues to be good news. You'll see there that our testing rates, although they have continued to be lower than they were during January and February, they actually haven't dropped as low as they were last summer. So we're still doing adequate testing, but that is something that we want to make sure doesn't fall further. And we'd like to keep it at this level going forward over this next few months, this next season. Our next slide is our weekly report for the Coachella Valley, which is District 4 in Riverside County. And you'll see here for the first time in months and months and months and months, our new weekly deaths are at 0. So here in the Coachella Valley, we had no deaths this week from coronavirus. And I'd just like to take a moment and smile about that and just be a little bit happy. Our new weekly cases also have continued to drop, and we're at 209. Every now and then we draw your attention to doubling time, and there was a point at which our doubling time was in the low 30s. It means our cases were doubling every 30 days. We're back up. We're pushing that 3-month mark of 85 days. This is really good news. This means our level of transmission is at a low level. Let's go ahead and go down to the bottom of this slide. And what we'll see down at the bottom is that our transmission and hospitalization rates are, again, sort of trending downward. If you look at our hospitalizations, the beginning of the week, they were up around 50. End of the week, they're, closer to mid-30s. So they're, again, trending down slowly. Our ICU numbers are pretty much stable. And then our positivity rate has been following the counties and is now at 3.5%, which is great. That is definitely moving in the right direction. And let's go to the next picture, I believe is what I have. We've moved as a state into this weird new way of calculating tiers. And I wanted to show this to you a bit because right now we're in the red tier. We just moved into the red tier. And so that is defined at this point in time as 6 to 10 new daily cases per 100,000. We're at about 6.6, and at a 5.0 to 8 positivity rate. And we're actually under that. I think we're in the threes now. So that's kind of an interesting thing. You know, we're well in this red tier. According to the rules, we have to stay in this tier for at least 2 weeks before we're eligible to move to another tier. So we'll be here for at least a couple weeks. But these tiers, the data points we have to hit to get into each tier actually change based on how much vaccination is being done in the first quartile of our population. So what does that mean? That means they break our entire population of California up by income and income of an area into 4 different quartiles. So the bottom 25% of the state had 2 million vaccinations done, and they gave us these rules. Once we hit 4 million vaccinations in that lowest quartile, we get a new set of rules. So let's look at the next picture, because that has the rules that will apply to us when we hit 4 million vaccinations in that lowest quartile. So is this the last picture?
Dr. Burris, give me just a second. I didn't see that extra one. Let me just dive in there and see if I can get it.
Okay.
So do you want to explain, and then we can show the picture?
So basically what it does is it makes it easier to get to a lower tier once we hit that 4 million mark. And we are actually super, super close to going to that orange tier. If you look at it now, we're at 6.3 new daily cases. And so that would be, we're super, super close to that. And it may be here. Let's see if this one is it. But once we get to 4 million cases, we'll basically be in the orange tier as long as we don't go back up. And we're already there for our positivity rate. So that's something that I think should help motivate us to make sure that more people who are living in our more disadvantaged communities are getting access to the vaccine and are getting encouraged to get the vaccine. This is not something that was done just to annoy us. This is actually a public health approach to make sure that the entire community, as well as the community, part of the community that's been hardest hit by the COVID epidemic, that they are included in the rollout. And by requiring a certain number of vaccines in these communities, we're just ensuring that our entire community is much better protected when we're opening up. So this is something that kind of confused me, because they changed this just a couple weeks ago. And the day that LA County moved into the red tier they moved into the red tier the moment we gave that 2 millionth shot. So it was like at like 3:00 in the afternoon on Thursday, and suddenly they're in the red tier. But that was why it was done at such a weird time. It was actually just dependent on that vaccination number. So now we're working towards that 4 million mark, which probably will open up the ability to us to go into that orange tier. And what does the orange tier move mean? It basically increases capacity inside at many of our venues, as well as may allow more events to occur indoors rather than outdoors.
And I think the schools actually are also, once they hit a threshold, are able to go to indoor sports. But then that opens up a whole another set of criteria that they have to meet in terms of testing and so.
Right. So where we are now is that 2 million vaccine, and it's going to take longer to get to the orange tier, and using these criteria. But if we move up in our vaccinations, then it'll be easier to get to that orange tier and yellow tier. So that was kind of what I had to say about that data.
So is there anything else you wanted to talk about today, Dr. Burris?
Well, we could talk a little bit about the AstraZeneca stuff. Did you talk about that yet?
No. We do
So
only have
in the
probably like
news,
3 minutes. So
yeah, I can do it in 30 seconds. In the news that you may have heard that the AstraZeneca vaccine, which by the way is not being used in the United States, this is the Oxford vaccine that was developed out of England and Germany, I believe. This vaccine was halted. It was halted because they noticed, I believe it was 30 something cases of blood clots in people who had received the vaccine out of several million. One report said 4 million, the other said 17 million. But really what that means is they need to go back in and double check that the vaccine wasn't a cause of this. It is not all that concerning to me because it is not a higher rate than it is expected at baseline in a population of that size. So I think this is, just being extra careful. I think once this all sort of gets looked at, I'm pretty confident that the vaccine rollout in Europe will restart, and they'll be able to use the AstraZeneca vaccine again. But if you hear about it, that's what's going on. It's not a huge number of patients. Again, it's of what would be expected for a population of that size. A certain number of people are going to have blood clots every month, and so this got a little bit of media attention and people got nervous. And so in order to reassure people that the vaccine is safe, I think they're wise to stop and double check and make sure that there's nothing more to it. But right now it doesn't look like a huge red flag, just more of a something that needs to be properly researched. So that's all I have to say about that.
more than I have to. So I guess I would say that, this is good news that we're moving into red. It sounds like moving into orange is actually going to be a little bit easier once we get to that 4 million mark. And then that would just make yellow even easier. But we are at this precipice of, if we can all just hang on to social distance, not that, we shut down, but follow the rules, social distancing, we can assure that the yellow and the Christmas and Thanksgiving will happen. I say that with a little bit of caution, like Dr. Fauci says, cautiously optimistic, because I see images of spring breakers in Florida and all these other places where they are just wide open, no social distancing. And that is exactly where we were before Memorial Day last year, and how we got out of the red zone back into not even purple, more restrictive than purple. And so I don't want to go through that again. I know everyone else doesn't. So like you said, if we can hold on for another month or two, and I'm not talking, the purple restriction, do the red restricted tiers, but do it smart, social distance, so that we all can get out of it. And if we can't, then it's just going to be frustrating and tragic and sad.
Right. And I feel like people don't believe it's possible that we'd get locked down again, but parts of Europe and again parts of Canada are looking at doing that very thing. And psychologically, I think that would be a very hard blow. So I'm hoping that we're racing against these variants right now, and the only way we can win is if everyone cooperates.
Right, and I know this is probably not the most appropriate, but I think of it like a pool, and I'm seeing one person pee in the pool. I'm like, oh, okay, but then as more people start to pee in the pool, I'm getting a little more nervous, and so that's really what we need to prevent. So that's my little
Thank
boy
you.
humor. Sorry.
Thank you so much. Okay.
So don't pee in the pool.
Exactly.
Oh, yep, we got to go. Our next show is Your Personal Health. Please join us. We'll be right on again. Thank you for joining us, and we'll see you next week.